Your ingrown nail that is untreated for a long period of time can progress into a bone infection, and bone infections are very expensive to manage. Hello everyone, welcome back to my channel. I'm Teddy Blessings. If you're new, subscribe and don't forget to hit that notification bell so you get alerted each time I upload a new video. Well, I'm back again with a new video, and today we're going to talk about ingrown nails. We've seen procedures or people treating ingrown nails, surgeries about ingrown nails, but do we even know what causes ingrown nails? Do we? So today I'm just going to be talking about what ingrown nails are, causes, the symptoms, and then the treatment, basically. Ingrown nails happen when the edge of your nail starts growing into your skin. This causes pressure and pain along the nail edge, and sometimes the nail edge can cut through your skin and cause bleeding. Ingrown nails happen more with toenails than with fingernails, especially the big toe. So what are the signs and symptoms of an ingrown? How do you know that you have an ingrown nail, or how do you know that your nail has started growing into your skin? You will typically have symptoms in stages. First, you'll have swelling, and then there will be tenderness. Tenderness is pain on touch. When you touch, you feel the pain, but when you don't touch, you don't feel the pain. And then hardness. The skin around your ingrown nail will become hard. If your ingrown nail gets infected, then you'll move on to other symptoms, including redness. The skin around your ingrown nail will become red, and then pus may come out of your nail. You may get bleeding. We said when your nail when the edge of the nail cuts into your skin, you will get bleeding, and then pain will be there on touch or without touch, and then you may get shivery or hot. And now that we know the signs and symptoms of ingrown nails, let's talk about the causes. You're more likely to get an ingrown toenail if, one, you cut your nails too short. You're supposed to just trim the nails, but not cutting them too short into the skin. That will make you more likely to get an ingrown nail. And then two, if you round your nails at the edges when you're cutting, sometimes when we go for a pedicure or a manicure, sometimes those people tend to round or cut into the edge of your nail. They're not supposed to do that, and you are not supposed to do that. You're supposed to cut straight across the nail without rounding or cutting into the edge of the nail. And then three, if you put on ill-fitting shoes or put on tight hosiery that press your nails into the toes, then you're more likely to get an ingrown nail. Then three, if you keep on putting repeated stress on your feet, maybe through poor posture or through physical activity like running, playing soccer, or dancing ballet, you're more likely to get ingrown toenails. And then if you injure your toenails by stabbing it or jamming it, you're more likely to get an ingrown nail. And then last is, some people inherit them. Some people inherit the genes that make them more susceptible to getting ingrown toenails, so it can be genetic. So if the condition that is causing your ingrown nail continues, then the skin around your ingrown nail may undergo permanent changes in tissue, which will make it infected, and then this will cause more pain and more swelling. If you avoid doing the things we talked about, the causes of ingrown toenails, then you have these chances of getting an ingrown toenail. But if you get an ingrown toenail, then how do you manage it? If your ingrown toenail is not infected, then you can easily manage it or treat it at home by doing the following things. One, soak your feet. You can reduce swelling and tenderness by putting your feet into warm water for 15 to 20 minutes, 3 to 4 times a day. Then keep your feet dry. Let your feet breathe to avoid sweating and dampness. And then you can use a wedge to lift your nail. You can use dental floss or a piece of cotton by putting it under the edge of your nail to help lift it as it grows. You have to change this dental floss or the cotton, whichever you use, daily. And then apply antibiotic cream on your toe, on your ingrown toe, and then cover it with a bandage to protect it. And then choose good shoes. Avoid putting on high heels, and then choose open-toed shoes or shoes that have plenty of room in the toes. And then you may need to take pain relievers. Some over-the-counter options like paracetamol, ibuprofen can help reduce swelling and pain. So after you've tried out all that home care and your ingrown nail doesn't get any better or gets worse, then your doctor may need to treat the problem. Your doctor will need to treat the problem. The doctor may prescribe for you antibiotics. You may need oral or topical medication to get rid of the infection. Then your doctor may also use a splint. If your ingrown toenail or if your ingrown nail, it can be any finger or toe, if it is mild and does not involve pus, your doctor will use a splint to lift your nail to a new position to help it grow above your skin. Sometimes your doctor may need to remove the infected part of the nail. The doctor will numb your toe and then surgically take away or cut the part of the nail that is growing into your skin. And then other times the doctor may need to remove the whole infected nail. Yeah, if you keep on getting ingrown nails on the same toe or the same finger, then the doctor will need to remove the whole nail. And it usually takes around 4 months for the nail to grow back, so it is not a big worry. So basically, that's how you can manage or treat ingrown nails. Ingrown nails have complications, by the way. They do. If you are a diabetic, if you have vesicular problems, or if you usually get numbness in your toes, then you need to take special care to treat and prevent ingrown nails. And do not put off your treatment. Ingrown nails that go untreated for a long period of time can progress into severe problems. You may get complications like one, bone infection. Yes, your ingrown nail that is untreated for a long period of time can progress into a bone infection, and bone infections are very expensive to manage. If you have a relative or if you've ever gotten a bone infection like osteomyelitis, then you know what I'm talking about. And then another complication is foot ulcers. You can get foot ulcers, and then you can also get gangrene. Gangrene in simple terms is tissue death, and this can progress into loss of a limb. So you should take care to treat an ingrown nail in case you get it, so it does not get complicated. So basically, that's what I had for you today. I hope you found this video helpful, and if you did, like, share, subscribe, and don't forget to turn on your notification bell so you get alerted each time I upload a new video. Thank you for watching. Don't forget to like, don't forget to share, subscribe. See you in my next video. Bye.